Prostate cancer is the second most common cancer diagnosed in men globally. In the Philippines, it is the third most common cancer in men, following lung and colorectal cancer. So what is prostate cancer? Prostate cancer is a cancer that occurs in the prostate. Before we dig deep into the details of the prostate cancer, we should first be knowledgeable about the anatomy of the prostate. Males have a prostate gland about the size of a walnut. This gland produces a part of the semen that will nourish and transport the sperm. There are 4 major zones within the normal prostate. The first is the peripheral zone, representing the area around the gland. This is the most common site for developing prostate carcinomas. Second is the central zone, which surrounds the ejaculatory duct, a duct that receives the sperm from the vas deferens and the semen from the seminal vesicle. Third is the transition zone that constitutes 2 small lobules surrounding the urethra. This is where benign prostatic hyperplasia, or BPH, primarily originates. The last is the anterior fibromuscular stroma. The base of the prostate is near the neck of the bladder, while the apex is above the urethral sphincter. At the back of the prostate is the ampulla of the rectum. The levator ani muscles that support the pelvic organs and assist in continence lies in the inferolateral surface of the prostate. The prostate is divided into right and left lobes, which are further subdivided into 4 lobules: the infero-posterior lobule at the lower portion, the inferolateral lobule beside the urethra, the superomedial lobule deep into the infero-posterior lobule, and lastly, anteromedial lobule, which is into deep to the inferolateral lobule. Blood is supplied to the prostate gland by the prostatic artery, while blood is drained mainly by the prostatic venous plexus that connects to the vesical venous plexus superiorly and internal vertebral venous plexus posteriorly. Nerve fibers of the prostate are from the pelvic splanchnic nerves by way of the prostatic plexus, which receives its fibers from the inferior hypogastric plexus. Let's follow the case of a 66-year-old man experiencing painful urination and blood in his urine.
Nak, sakit na ako pagpangihinap. Pero friend ako po, kramanjugni, kinang-inom ako po, karapol, tihinit.
Coke, nasan pa? Ano ba ako ni mo nandili na mag-coke? Wala na bayad na nakabata. Dapat magmatno na masay mo lawas, tigulang na ka.
Ang kataliwang hindi kayo magsakit kayo mga pag-bihis ako. Nak, murag kamay dyan ako na ihiyaw na nagahapon bitaw kasi yung kahit po niya magsakit bitaw siya niya. Sakit po na dyan kaayo. Murag dito dyan na gulong magpa-check up ba ko. Kung kailangan dyan tambal.
Uban ko pa?
Ino mo kay klase yun.
Sige lang, uban ko. Mag-ilis ako.
Dito dyan. Necessary behida. Ako daw. Sige. So, man mo tag sir. Ang siyang matawag mo sir. Panahon sakit yaw for panghidok na before pa po niya ay ito na po ko pero may yung nagkawas mga server. Gusto naman yung kadugaya ni skit sa ko po yun sir. Walang biya ko kayo nung pero akong found ko is ever magsakit po mag-finale joke ko with them kids. Kari. Kung sir, when man mo nas tomorrow with finamic?
Gabi man siguro to pa?
Ang rag ko. Before pa, ang rag, pagpan niya po. Sige sir, sa karon sir, kay another din mga pangutanan niyo sir, ha? Paliyag lang fill up pa ng form sir, pa ng nakabanda dito sa inyong condition sir yan. Na, mag-check sa gusto yung mga vital signs sir. Sir, sunod na sir, nasa doktor ang gusto. Sige. Tara.
Good morning, sir. I'm Dr. Josol, a urologist of the SMRC. Before tayo mag-start, may I know your name and your age?
Ako guys si Juan de la Cruz Doc. Kuhaan si Sintay, Science Anyos na.
So, nato ko'y mga pipinakapautan na para palibawaan na to ang sa mga away nga procedures na atong buhaton. Kasama na to may bate ron, sir.
Ito hapon do, tayong marag kahit nagkaroon ng gani kay marag hikon kay ko, pero marag sa una raman dyan ka recall pero marag last week pamuguro ni kunya kanang kakuhan ko do kanang every time na kahit on ko murag kamay doon ako makuha na niya alongside with that doc mag-sakit-sakit po akong kuhan do probably kahapdos.
Maka-describe ba ka, sir, ang sa tawa pain?
Murag kahapdos ka yung kuhan grabe kahapdos.
Kung makarate ka from 1 to 10, with some moment.
Around 8 to 9.
Okay, daghan kayo salamat sa imong cooperation. Ako na recommend na mag-undergo ka og digital exam.
Ito na siya na procedure to.
Pananga procedure kay pakita na lang nako.
There are different tests used to diagnose prostate cancer. One is the digital rectal exam or DRE. The doctor inserts a gloved and lubricated finger into the rectum and feels toward the front of the body. In this method, the rear section of the prostate gland can be felt. The results of this test are compared to notes from the patient's previous digital rectal examinations. Another is the prostate-specific antigen or PSA blood test. The PSA test can indicate an increased risk of prostate cancer if the PSA level is elevated or has changed dramatically over time, but it does not provide a clear diagnosis. Patients with low PSA levels can develop prostate cancer, but this occurs less than 20% of the time. Further testing may be required to rule out prostate cancer if the PSA level is elevated. Levels might vary depending on age, the size of your prostate gland on inspection, certain drugs you may be taking, or recent sexual activity, or has increased significantly over time. Last is the prostate biopsy that includes obtaining a sample of tissue from a specific location of the body. The presence of cancer cells in a biopsy sample collected from the prostate gland is the only way to definitely diagnose prostate cancer.
Thank you so much, sir, for your cooperation. So, balik lang ta after 1 week para sa imong result.
Salamat kayo.
Pa,
Enzo.
ayun, pag-uon. Ma-opera na ginipon. Opera na yan results.
Huwag lang bagta po kay Bong.
Sir De La Cruz, pwede na mo son, sir.
Dok, grabe ba ako condition, Dok?
Sige, di ba, last time, sir, nag-recommend ko nga mag-undergo ka o prostate cancer na screening based sa inyo mga signs and symptoms. Unya, ang result adto, elevated in mga PSA levels. Unya, after adto, medyo ba kita na ito exam mo punta. So, pag duwan na ito adto, natin area, damang na lumps. So, after adto, may biopsy ko.
Ayaw, gusto mo results ko.
Sa kinood ng sir, ang resulta sa biopsy, ang magawas din positive for prostate cancer. Pero ang cancer naman na siya yung pagka-stages, stage 1, 2, 3, and 4. Huwag tanong ang imuhan, phase, and stage 1, 5. So, half lang sa isa ka side ang naapektahan sa inyong mga prostate.
Yung kabit ko, kadok ba ng ano yung I'd na siya prostate cancer na.
Sige sir, na ko yung video sa akong computer para ma-explain dyan yung taro. After na, kung lahat kang matanda.
What is prostate cancer? Cancer happens when the growth of cells are uncontrollable, leading to the development of abnormal cells. Prostate cancer begins with a mutation in normal prostate glandular cells, starting from the peripheral basal cells. The peripheral zone is the most common site for prostate cancer and is susceptible to inflammation and can be palpated via digital rectal examination or DRE. The cancer cells grow and begin to multiply, initially spreading to the immediately surrounding prostate tissue and forming a tumor nodule. Prostate cancer commonly metastasizes to the bones and lymph nodes. Metastases to the bone are thought to be partially due to the prostatic venous plexus draining into the vertebral veins. Adenocarcinoma is the most common type of prostate cancer. This type affects the gland cells that produce prostate fluid that is added to the semen. Other types are small cell carcinomas, transitional cell carcinomas, and sarcomas. According to the DOH, prostate cancer is the 5th leading cancer site and the 3rd leading cause of cancer deaths among Filipino males, citing 2020 statistics from the Global Cancer Observatory. Meanwhile, the Philippine Cancer Society reported in 2015 that approximately 6 out of 10 instances are diagnosed among men 65 and older. Prostate cancer-specific causes are unknown. Several risk factors for developing prostate cancer have been found, but it is unclear of which of these risk factors causes a prostate cell to become malignant. Changes in the chemicals that make up the DNA, which makes up the genes in the cell, must occur for cancer to form. The genes regulate how the cell functions, such as how quickly it grows, splits into new cells and dies, as well as to fixing any errors in the cell's DNA to maintain the cells functioning normally. Cancer develops when certain genes that govern cell growth or death are mutated, resulting in aberrant cell proliferation and/or death. Certain risk factors can put a person at risk for prostate cancer. Among these are the following. First is age. 60% of cases of prostate cancer arise in men over 65 years of age. The disease is rare in men under 40. Asian and Hispanic men are less likely to develop prostate cancer than are non-Hispanic white males. Prostate cancer can run in families. A man whose father or brother has or had prostate cancer is twice as likely to develop the disease. The younger the family member is when he is diagnosed with prostate cancer, the higher the risk is for male relatives to develop prostate cancer. The risk of developing prostate cancer also increases with the number of relatives affected. Nationality is also a risk factor. Prostate cancer is more common in North America, Europe, the Caribbean, and Australia. It is less common in Asia, Africa, and South and Central America. Multiple factors such as diet and lifestyle may account for this. Mutations in a portion of the DNA called the BRCA2 gene can increase a man's risk of getting prostate cancer, as well as other cancers. This same mutation in female family members may increase the risk of developing breast or ovarian cancer. Other factors such as diets, high in red meals and fatty foods, and low in fruits and vegetables appear to be associated with a higher risk of developing prostate cancer. Obesity is also linked to a higher risk of the disease. Increased calcium intake and dairy foods may increase the risk of prostate cancer. A patient with early prostate cancer is frequently asymptomatic. However, late-stage disease and sometimes early-stage disease may exhibit signs and symptoms such as difficulty starting urination, weak or interrupted flow of urine, urinating often, especially at night, trouble emptying the bladder completely, pain or burning during urination, blood in the urine or semen, and painful ejaculation. Many symptoms of early prostate cancer can also be attributed to benign, non-cancerous prostate diseases, such as benign prostatic hypertrophy or BPH, or infection in the prostate gland or urinary system. The following are signs and symptoms of advanced prostate cancer or late-stage prostate cancer that has already migrated from the prostate gland to the other parts of the body, referred to as metastatic prostate cancer. Patient may experience a new, dull, then progressively severe pain in the bones, especially the low back, unexplained weight loss, fatigue, increasing shortness of breath while doing activities previously well-tolerated, low-impact fracture of bones without a lot of trauma, or broken bones from minor trauma, and swelling of the legs related to the obstruction of the lymph tissue by prostatic cancer. It is always preferable to detect and diagnose prostate cancer at an early stage while it is still localized to the site of origin.
Ito, pero also may pwede na ito buhabang dok napatay. Masolusyonan pa na, dok?
What are the treatment options for prostate cancer? Stages 1 and 2 have similar forms of treatment. First is active surveillance. Second is hormone therapy, also radical prostatectomy followed by radiation therapy. For stage 3, transurethral resection of the prostate or TURP. For stage 4, we have alpha emitter radiation therapy, biphosphate therapy, and lastly, the radiation therapy.
Since you have stage 1 cancer, we suggest radical prostatectomy followed by therapy nga external beam or brachytherapy. Kanya naapod tayo active surveillance and then mag-hormone therapy po ta.
Maka-survive ba ko na, Dok?
In your case, stage 1 cancer, only half of one side of your prostate is affected. So almost everyone na ay stage 1 cancer, mapasurvive lang for 5 years or more. So as long as sundod na to ang proper management, we will be more or less fine.
Thank you, Docs.
Sige, no worries, sir. I suggest i-istorya ng mga sa imong family na already nakamotosin sa management para sa ay sa hospital.
A cancer diagnosis can be extremely stressful for both the patient and his family and friends. At times, dealing with the diagnosis, sickness, and therapy can be difficult. Searching for information online can also be overwhelming and is not always the greatest resource. Inquire your doctor or a local hospital about available resources in your area. Local prostate cancer support groups can often help you cope with your feelings and provide local resources for more information. There are ways to prevent the occurrence of prostate cancer. One way is to keep a healthy body weight. Obesity has been linked to aggressive forms of prostate cancer and a higher risk of the cancer returning. Another is to engage in regular exercise to help reduce the risk of prostate cancer. It improves immunological function, decreases inflammation and weight gain. It also helps you to clear your thoughts and reduce stress. Also, it is necessary to avoid smoking and drinking alcohol, as this can reduce the risk of cancer. Lastly, have a regular doctor's appointments. Don't dismiss anything out of ordinary. Routine testing is critical. Men over the age of 50 who have a family history of the disease should be checked periodically. Regular checkups are recommended as early as age 45 for people who are cautious. A urologist will recommend a PSA test as well as a digital rectal examination and an ultrasound for early detection.